Wendy Zenker. I'm the Executive Director for Arlington Neighborhood Village.
All right, welcome. Brenda.
Okay, I'm Brenda Cox, and I'm the coordinator of the Lomax Senior Ministry at Lomax AME Zion Church in Green Valley.
All right, welcome. Link. Link, we did not hear that.
You're muted.
You're muted.
Hey, got that one
Okay.
fixed. Link Cummings, the chair, Arlington Commission on Aging, chair of the Positive Aging, Inclusion and Enrichment Committee.
Okay, welcome. Laura.
Hi, good afternoon. I'm Laura Polari-Welbus. I'm with Encore Learning. It's a lifelong learning program in Arlington, been around for 20 years, and I'm happy to be here today.
Okay, welcome. Nice to see you. Jessica.
Hi, everyone. Can you hear me?
Yep.
Okay, sorry, I had to move over to a different cubicle. I'm Jessica Vasquez. I work with the Office of 55 Plus Programs with Parks and Recreation. Thank you for having me. So I do the outreach and promotion of the programs.
Good. Glad to have you here. All right, next is Steve. Steve Cordell.
It was unmuting. My major volunteer activities right now are with, I'm a member of the board of the Friends of the Planetarium and at Arlington Independent Media, where, like Cheryl, I help people produce television shows, mainly by directing and editing and doing audio. Thank you.
Okay. Nice to have you here, Steve. In fact, I may be sending you an email after this program.
Okay.
All right. Patricia. You're muted.
Okay. Can you hear me now?
Yes,
Oh,
ma'am.
Okay. Hello, everyone. This is Patricia with the Center for Optimal Aging from Marymount University. Thank you for having me.
All right. Did I miss anyone? I'm looking down the list here. Jim Morris, I don't know if, can we hear Jim?
Jim says he has no mic or video.
That's correct.
Okay. Well, I haven't seen Jim in a while, but Jim is probably, I would say, very busy because it's the tax season. And I do know that Jim is a tax aide with AARP. And so that's one, he's very much involved in AARP activities. So Jim, we're always happy to have you here. So I think I got everyone. And hopefully Carlos will be joining us sooner or later, but again, we're going to get started. Wendy, I noticed you're still having lunch. Do you want me to wait?
No.
And just to kind of give you an overview, one of the things that certainly since I became chair and then when Carlos joined me on the as the other co-chair, we often would get presenters, which was great, but we've never really had an opportunity to hear about what each of you are doing in greater detail. It's kind of like, well, we're going to doing this and doing this, but it's very abbreviated because we didn't give you very much time. And so instead, we wanted to focus on you this time, on each of you. This is January 2023. You got a whole year coming up. And so it's kind of a double purpose. We can all hear more in detail of what you're thinking about, even to the point of, goals. You're going to look for new members, things like this that might be helpful, because I think that's of interest. And then the other part is the fact that Michelle McMahon is becoming or is involved now with the Senior Ambassador Program. It's even more important for her to be learning about all of these programs so that she can put together and work with you, Patricia, and Rita, to put together a binder so that people will, the ambassadors will know about these programs. So it's kind of a dual purpose. So with that said, I'm going to start, and I'm just again going to move right through the line here. And if you don't have anything to say, that's fine too. But if you do, that's the purpose. And the nice thing now is that Michelle Thomas is recording this. So for those folks who are not in the program today, we can send this out so that the information can be shared with them. So Wendy, I will start with you and go for it.
Sure. Michelle, by chance, can you give me screen sharing ability? Can I share my screen?
Yes, ma'am, you can share your screen.
I mean, it just, Cheryl, you mentioned this and I wasn't 100%. I thought I'd just be talking, but the reality is I actually probably have something I can share.
Okay, cool.
So let's see if I can, I've never done it on Teams before.
There's a box at the
Yeah,
top.
no, I
of the
saw it.
screen. Okay.
So I'm assuming that you guys can see that slide right now.
Okay.
Yes.
So I've got a presentation that I used. I did a presentation actually on Saturday. So I have a big presentation that I did on Saturday, but this is a slide from that presentation that I think is probably helpful to people. So I think all of you know that Arlington Neighborhood Village is a community-based nonprofit that, as we say, gives people the extra help that they need to stay in their homes safely and independently. And that oftentimes means giving people rides to a medical appointment, to the grocery store, the post office, the bank. It means getting up on a ladder and changing a light bulb, being a friendly visitor, being a walking buddy, helping them with tech, or just going shopping for them at the grocery store or delivering food from the food bank. So those are the kinds of things our volunteers do. They also help run the organization. So we've probably got 50 volunteers who are just involved in what we think of as management roles. That includes our board of directors. It includes people who work on our different committees, and it includes volunteers who work here in our office. I mean, every day we have 2 volunteers in the office that are answering the phones, updating our database, and making connections with people. So, overall, we think we have about 250 volunteers involved in the program, but those volunteers are supporting 335 members right now. And those members are range in age from 58 years old to 102 years old. The majority of them are female, 73%. They are older. So 42% of our members are over 80 and 87% are over 70. 58% of our members live alone. And of our members who live alone, the vast majority are female. And when I say the vast majority of female, that's 84%. So of the 58% of members who live alone, most of them are female. So, women who are aging by themselves. 33% of our members right now, 108 of them, receive some help with their membership fees. 31% of them have mobility issues, are using a cane, a walker, a wheelchair perhaps, or have eyesight or hearing loss. And 15% of them today represent diverse backgrounds. And we, of course, want to see that number go up. But that's who our members are and what they look like. I mentioned that we have a membership fee, and that speaks to, why do we need to raise money if we're volunteers? Well, we have a small staff. We have an executive director, a member services manager, a member services specialist, a part-time volunteer coordinator, someone who works on special projects, and a very part-time care manager. So we've got to raise money. Our budget for the year coming up is going to be about $500,000. So we've got to raise $500,000. And the way we raise money is through our membership fee. We apply for grants and we seek individual donations. So when you're looking at what our expenses are, what makes up that $500,000? Well, like any organization, the bulk of that expense is the paid personnel, the people that I described at the very beginning. But we also rent space in Church of the Covenant. We've got 2 floors here. We have computers, we have internet, we have telephone service. All of our volunteers go through a background check for both a criminal history and a driving record. We have insurance coverage. We do events and need money to pay for those events. We have a bookkeeper, we have some technology support. This year, we'll be having a financial review conducted of our books. You know, as we get bigger, the sort of administrative requirements become greater. Obviously, we have a website, and this past year, we built a new website. There are expenses associated with that. So all said and done, we have expenses, and we have to raise money for those expenses. And one of the ways we raise money is through this membership fee. I think, you know, you guys know the fact that we operated all through COVID, but one of the things that COVID did was help us expand our services to more seniors in Arlington. So that, as I mentioned a minute ago, a third of our members are low income. And again, you know, just as a reminder, we do have a membership fee, but for members whose income is under $47,000, our membership fee is dropped to $100. Members whose income is under 36,000 drops to 50. And if your income is under 26,000, it drops to $25. So you can see that our financial aid fund, which supports these reduced membership fees, supporting the 108 people, is, you know, something that's very important to us and something that we raise money for on a regular basis. I think if the question becomes, you know, with us as to what's next, that we're growing. We have a 5-year strategic plan that our board approved this past year. Our intention is to expand services to more seniors from all across the county at all income levels. We have some very strong partnerships with APA and AFAC, AHC, Culpeper Garden, with County DHS. We are really looking to strengthen our financial aid fund so that we can continue to grow and not have income be a barrier to participating in ANV. And we're looking to diversify our income streams. I mean, it's hard to find grants. So we need to, you know, be on the lookout for more grants, perhaps more corporate sponsors, and more support. I mentioned that we launched a new website. If you need to go visit, you haven't seen it, it's anvarlington.org. So all of the information that I've just talked about is up on our website. You can imagine that we've got folks who are appreciative of the work that we're doing. And we hear from them all the time, from our members and volunteers. And, you know, one of my favorite pictures is one that we took at Christmas time. So we had a Christmas get together, and we had, I think, about 80 people that attended that Christmas get together. And I didn't let people leave without us being able to take a big picture of everybody who was there. So that's essentially who we are. I think you guys all have our contact information, my personal contact information. But I hope that that gives you a sense of who we are and what we're doing and what our goals are for the coming year. Can't hear you, Cheryl. You're muted. Yeah.
Yep, I got it. Any questions for Wendy? Okay, well, then we will go on. And thank you, Wendy, for keeping it to about 5 minutes or so, because we want to make sure that everybody gets a chance to chat as well. So 5, 6, 7 minutes is good. So let's see. Looking at my screen now, the next I see is Patricia. Do you want to talk about the center and kind of give us a summary of what's expected? Because we've had you on before, which was very, very helpful, but kind of what's coming up.
Yeah, I did also a presentation last week. So I'm going to I promise to be brief today. Regarding the meeting today, and for the time being, I think some of the developments is with the ambassador program. We're also moving along with MU. And so I have now, I would say, almost a part-time webmaster. So we want to really support the ambassador and expand that and develop a whole website and webpage where we can list the ambassador program resources and also have that as a resource for everyone. We also are starting with the series that we are working with you, Cheryl, with so Sarah Papa is leading that, with the health and wellness and fall prevention. And the idea is to have like your channel as being also another way to provide education and support and empower our community members to be healthy and learn about some approaches that they can do themselves. And third one, we are now advancing the initial framework of our health passport, which is like to create that comprehensive health assessment program that will not only evaluate, test some of those key areas that are important to keep someone independent, mobile, and with good quality of life, but also support that through a health recommendation. So we're going to use that assessment to provide personalized health recommendations that our participants can take to their doctors, can use with their family in their caregiving environment, and create some goals to attain to wellness. So those are the three mains for today. That there's lots of other projects and activities going on. Also, I think with Wendy, we are looking as once we prepare the protocol, when we have all the players involved at the MU. So we are collaborating with several different health professionals in terms of those health outcomes, and to help us to do the oversight of those different areas of health. But once we have that program and the protocol more developed, we are interested in looking for funding, and the funding will rely on collaboration. So probably it could be something that we could also work with you in terms of going or having a standing program where we can provide those key assessments that are very simple but very powerful in providing information for people to take over their health and create some sort of bridging with what you are doing and some of those initiatives, and looking for funding to support that.
And thank you for that, Patricia. One thing I was just when I was hearing you say about the assessment, this is why this is a really great opportunity to kind of information exchange. Were you listening to the Commission on Aging meeting this morning, or were you not able to join?
I was not able to join.
Okay, and that's okay. But one thing to kind of keep in mind, and I can put you in touch with the proper person, but the presenter this morning at the Commission on Aging was a man by the name of Adrian Stanton, who is Vice President with Real Estate Acquisition and Development at Virginia Hospital Center. And he talked about the Virginia Hospital Center Community Health Assessment. And it was really interesting how, they do this every 3 years, and they interact with organizations in the community, and that helps the hospital determine what are the priorities, whether it's more psychiatric beds, because mental health is much more of a problem than the community sometimes knows. And that's why they've got this new wing for the hospital, is to have more beds. And so this would be a good opportunity for the center to reach out to Kate Shatalpi, who is also a member of the commission, and she got Adrian Stanton to come to our meeting. So I'm happy to facilitate that as well. But
That would be great.
Yeah, I mean, in terms of looking more at what is the community needs here, would certainly help in terms of for the center to be addressing those same needs. So, and also providing your input from what you're learning as well in terms of research and education and this kind of thing. So,
no, definitely, that's so important. Is the linking, that's always important. So I would love to learn more about it.
yep, I will definitely have Kate send you some more information, and perhaps Adrian's contact information, because he welcomed additional organizations to provide that information, So I will be back in touch.
That community center is like this assessment of community center, usually community health. Is that like by providing a space where they're going to be extending some of those services that usually are not part of the healthcare system, or this is just like where they evaluated by bringing stakeholders and evaluating some of the local clinics and having more of input, feedback from the community itself.
I think what it is, Patricia, is that they kind of have to determine what the priorities are. And once they gather the data from all of the different organizations, they look at it, kind of prioritize it, determine what sort of resources the hospital has already, and then they make a presentation to the board of directors. And then the hospital board determines what are we going to do next? You know, what do we have here, and what do we need to do? Some may be expanding a particular department, some may be, you know, building a new building. I mean, the hospital apparently, and I didn't know this, has been around for 75 years. And so even some of the buildings are, you know, getting old and need to be renovated and this kind of thing. So obviously, Mr. Stanton was only there for about, you know, half an hour. But I just think that that's a really good resource that the center should probably connect with. So I will definitely do that.
No,
But I
that
want to
would
move
be-
on. I want to move on now to make sure everybody has a chance to talk. So Link, I'm seeing you next year. Do you want to talk about your committee, Commission on Aging Committee?
Yes, of course. Thank you. The Positive Aging Inclusion and Enrichment Committee.
Can't
is
hear you.
one- Can you hear me?
Now we can.
Now you can, if I get close enough to the computer. Our committee has a focus on programs and services in our community. It encourages active, healthy, engaged older adults in the community that values their presence and participation. We work with community partners, schools, local businesses to promote and encourage participation of older adults in our community. Our core World Health Organization domains are social participation, making sure that our 55 center community centers are well used, civic participation involving businesses, nonprofits, intergenerational activities, such as the walking school bus, which we piloted last year with great success and is now beginning to move throughout the county. Outdoor spaces and buildings, making sure that we counsel the county board and county manager on having our buildings elder friendly. We're adding another one this year, spams and elder abuse. We're seeing more and more of that. If I just think about the national legislation, it was reported that $800 billion were fraudulently taken out of the several trillion dollars of budgets. Locally, elders, seniors are the most likely targets, and we want to make sure that we understand prevention programs and help those who are attacked. We have a busy schedule and a lot of fun things to do. Thank you.
Okay, yes, Links Committee is always the one that is the most diverse in terms of aging and inclusion and enrichment. And so on any particular meeting, he always has exciting guests. So thank you, Link, for your good work. And, you know, let's make sure that we're all attending your meetings as well so that, you know, we can learn more. So thank you.
Yep.
Brenda, do you have anything that you would like to add about what you do at Lomax Church and what your plans are for this year?
Okay, I would like to share that this month we are celebrating our 21st anniversary of meeting once a month with the Lomax Senior Ministry. We started to provide members of the community with information about the services that are available to them. And to that end, We meet on the fourth Saturday, and this Saturday we're going to be partnering with our sister church, St. Michael's, and the Arlington County Department of Human Services is going to be providing the presentation on understanding well-being, the role of resiliency. And it's a conversation on the importance of community and building connection and resilience. We have partnered the county, we moved to another point this year with intergenerational meetings. And so the heads of 4 agencies approached our church and St. Michael's, and we've been having these community meetings. So we're going to have a meeting this Saturday on really building the connection, recognizing the services that are available to them. It's very simple. The county services are there, our tax dollars are paying for it, and we need to just make people aware that this service is available to them so that aside from the county doing outreach in the community, that they will know to reach out to the Department of Human Resource Services, because as I tell them, your tax dollars are paying for these services, and you're fortunate to be in Arlington because they are the quality of the service that's provided.
So Brenda, one thing I was going to ask you, and this is also giving a heads up to Michelle McMahon in terms of learning more about where potential ambassadors are. Are there other churches in Arlington that are as active as yours, and do they provide the same kind of programs that you do once a month? Can you tell us anything about, you just mentioned about a sister church, St. Michael's. Are there others? I mean, have you interacted? Can you talk a little bit more about other churches, or what do you know?
Well, to be honest, I really don't know. When I started, I had a committee. My goal when I started was to inform the members of our Black community about the resources that are available to them through human resources. And I did that as a result of having to take care of my mom. I took care of my mother the last 12 years of her life as she started to slow down. And I found out that, well, the girl that I grew up with worked at the Agency on Aging, and she said, Brenda, you need to contact the Agency on Aging. And I didn't know, I just did it, but it turned out to be a godsend. I did not know. I was still working, and just the support that I was able to get from that. And I figured that if I did not know that this resource was available to me as a resident of Arlington, that a lot of people didn't know. And so I ministered, not knowing the type of person I am. He allowed me to stand up in church and give and just share what I was doing. And I told the people in my community that, your tax dollars are paying for this. It's not welfare. And first and foremost, our members did not want to acknowledge that they were getting old. I said, if I need it, you need it. I was very blunt. And I promised, I just said, for whatever reason, I decided that we would have a monthly meeting. In my former life, I was a librarian, and essentially what I did in the public library, I brought to the church. And it's really a no-brainer. It's not common knowledge that the resources that you all are providing, and people need to know, not just seniors, but as when I started working with the Agency on Aging, and I was on the commission, I was going around and giving presentations to the civic associations in the county. And invariably, it wasn't the seniors that approached me after the meeting, it was their children, the caretakers that needed to know. So I have been trying to work with the caretakers, and just through the years, we've been doing this every month for the last 21 years. We have had meeting of the senior ministry at Lomax Church. If a holiday fell on the fourth Saturday, it was the third Saturday. And our goal is to just inform people of the resources that are available, that 1-800 number that's available. The federal government changes every 4 years and people come here to work, but they have relatives in other parts of the country. And that really struck me, that people that approach me, the younger people in the Civic Association. So I'm thinking that with this ambassador program, you need to reach out, not a senior fair. To senior fair is too much at one time, and people do not get the gist of what they need for their particular thing. But I'm you know, how do you eat an elephant one bite at a time? And I just told them we take one topic a month and just make sure you understand that, and the proof is in the pudding. I will never know the full extent of what this program has done. One of our seniors who is now, she's in a home now, she's gone into dementia, but 12 years ago, she told me, she just came up to me after one meeting. She said, Brenda, you know, when I leave this meeting, I call home and call my cousin in South Carolina and let her know what we're doing. And so, you know, the Lord has my back. It's in the church, and giving credit to the congregation, they have accepted it. We don't have a lot of meetings. I just say that come, and the proof is in the pudding. I will never know the full extent of the impact of the program.
Okay, well, that's very helpful. And Michelle, of course, you know, will be,
Yeah.
I'll be working with Michelle in terms of the faith community. I think that that's going to be a major resource to find senior ambassadors. So,
And I think Brenda might be our first recruit into our army of ambassadors.
exactly.
I've been doing it
like you're
21 years. I've been
You're
doing
already
it.
doing it. It sounds like you're already doing it, and you have the model that really a lot of other organizations can follow.
Yeah, and I would say that I sent Linda an email. The civic associations, the PTAs, even if you don't, not even the presentations, putting a newsletter in the civic associations monthly, just FYI, just letting people know. And the various, we really have to concentrate on the various ethnic communities here with the language barrier.
Yeah.
That really needs to be
We agree.
addressed.
Yeah, we agree. Yes.
Yeah.
Okay.
So.
Okay, I wanted to move on. I'm hoping that Laura will come back. She is with Encore Learning, and I'm not seeing her name here, so maybe she had to leave. But let's go to Jessica.
I'm
Jessica
here. Just give me
Vasquez?
1 second. My computer, I'm not in my normal location.
Okay. Well,
And Cheryl, just so you
Yes.
know, Laura did say she had to leave for another meeting.
Oh, okay. Well, she's with Encore Learning, Michelle McMahon. So that'll definitely be one that you'll want to keep track of as well.
Yep, I see her information in the chat. So
Good.
I've got.
Good. I'm sorry, I didn't look at the chat. So thank you, Wendy, for that heads up. So Jessica.
Thank you guys so much. So basically, we are the Office of 55 Plus Programs, and most people know us for our recreational programs, our travel program, our exercise programs, and of course, all of our classes that we promote in the 55 Plus Guide. But our goal in doing all these programs is really to provide that like social connection, enrichment, wellness. I always say like getting back to the activities you always wanted to do, but we're busy working or, with the family and stuff. So like arts, hobbies, anything of interest or recreation. And then of course, adventure travel. And then just like Brenda said, resources, connecting to resource. And then finally, of course, having fun. So our goal as an office, with everything that's been going on the last few years, it's, our office has been changing a lot, but first our goal is to kind of really come back fully. And also I know we're going to look a little different because the exciting part of us is that we also still continue to do our virtual or hybrid. So we do our in-persons, we do our outdoors, we do virtual, we do hybrids of all those. So that's been a really exciting for our office because we've been able to partner with other local jurisdictions. And it's kind of interesting because of the relationships we have built with our 55 plus population. That transition for us wasn't as difficult as we first expected. And I also loved it because it broke the barrier of people thinking seniors don't know how to be on the computer or how to work a computer. And it's just, I love that whole concept of the change. But for me, my personal goal is just like Brenda. I met Brenda many, many wonderful years ago. And we were just in tune about let's get the information and the resources easily to the 55 plus population, to the community, and especially seniors, people of color, or people who are more homebound or who may be living on their own. So it's something that I truly would love to get back to with our office. But currently our office, we work, we don't do it alone. We work through other organizations, specifically Alliance for Arlington Senior Programs, who's a 501c3. And of course, their goal is also to maintain active and healthy lifestyles for seniors. So they help us with fundraiser events, which we're going to be doing quite a few. Still, they allow us to do certain programming that we might not be able to do on our own, but they're able to assist or sometimes even provide financial assistance in some way to members. So that has been expanding. So that's something we're going to be growing in this year. We're going to continue with like the Affordable Connectivity Fair, which is that the U.S. government program. They run like the Federal Communications Commission, the FCC, to help low-income households pay for internet service and connected devices like laptops and tablets. And so we have vendors come and be able to provide questions and answer information, items, and then also assist if you want to enroll. And we've started to sometimes be able to open certain programs to all communities. So it's not just for seniors, while other things we want to just keep for seniors, a majority of our stuff, right? Because people get the 55 plus pass, but like basic computer classes that, just learning how to do emails and internet. And that's all done in partnership with like Arlington Community Learning. Other partnerships that we do is like Virginia Cooperative Extension, the libraries, Northern Virginia Falls Prevention Alliance, VIPAP with Michelle here, Department of Human Service, our internal unit. So really, we've been able to grow a lot with the partnerships and making new connections. So being part of committees like this is exciting because we learn about what else is going on in the community and seeing how we can be a part of it. Or sometimes maybe not even duplicating, but being kind of collaborative with it, if I should say. We're actually going to be working with Encore Learning, Laura, with the Arlington Philharmonic. And we're going to be doing concerts. And again, it's nothing that's specifically through us, but something that we can help spread the word to our members and partner with. And I also want to say that we work very closely with the advisory committees that we do have at our 5 senior centers. And I would love to do a shout out for them because they are always looking out for new members or for volunteers to assist with projects. And it consists of like monthly meetings and thinking of things to do for the center and projects. And it could be community service projects. It could be a party. It could be a class that they're bringing in. It could be just volunteer work. So things that, I think somebody put in the chat, I didn't see who it was, but they had mentioned the Spring Fling fashion show and silent auction. And that's going to be held on March 31st, 1 to 3 p.m. at Lubber Run. And again, that is something that the Lubber Run Advisory Committee has worked with the Lions or has worked them and then have included the Lions on being able to provide, great program. And so we're doing the 55 plus barbecue fundraiser at Rocklands again on Tuesday, June 13th. They, some of the proceeds will go to help with the programs themselves, dine in and take out. We are exploring more and more our nights and evenings. We have set days, like Tuesdays are for Walter Reed evenings. Wednesdays are for Arlington Mill evenings. Thursdays are Lubber Run. We also have weekends. So we're continuing to explore that as well. And that is more for the population we haven't reached, maybe the boomers who are still working. But I would like to say that we're also looking to explore to reach the population we don't even know exist. because they don't know we exist. So therefore we don't know they exist. And how do we do that? That's really the difficult piece. And so recently we're going to be working with the advisory committee, like a work session, to kind of think of everything we can think, like, why are we not reaching them? How do we find out information? How do we use maybe the census information, the current information? Maybe somebody in this committee, like Wendy just did a great presentation, like that's great how she got all that data. And then what does that mean? Maybe for us, how do we connect? So that is one of our goals for this year, including maybe bringing some bilingual programs in, maybe that's something. And then finally, I'd like to say one thing that we've also been doing a lot this last year has been like family programs, intergenerational programs, we usually call them. But really, it's one of our units who is already doing youth programs, and it allows us to kind of come in, and then grandparents could bring their grandchildren in, or maybe a grandchild's visiting for that weekend. And so you now have an activity that you can kind of build that family. I know for myself, one thing this year is I want to kind of rebuild my family again, because with the pandemic, everybody kind of got a little lost in the way. And so it's kind of like bringing that family unity, that community, that piece back in. And then one final thing is, please do not forget to share with your neighbors and friends and loved ones and caregivers that we do have something called fee reduction. So if, programs have cost in Parks and Recreation, it's just not a senior office. There is something called fee reduction. You do have to apply, but then it applies for 1 year and everybody in that household. So I do not want financial limitations to be a barrier for families. So we're kind of doing a little bit of everything as usual, but I'm very excited about the partnerships, because ultimately I want seniors in Arlington County to find an easy way to get resources. If it's not through us, then it's through somebody else or in this committee. So that's just a little gist of it.
And Jessica, I just had one more question before we turn to Steve Cordell, and that is are you still putting out the hard copy publication, or is it necessary just to go online? And if so, how's the best way for all of us and the new people, the ambassadors, to find out about all the 55+ programs?
Yeah, so that's been a little bit of a topic, recent discussion topic that we've been kind of exploring. We've been talking a lot about, so yes, online is the guide, but we've also been talking about like QR codes, like now that people are doing less paper. If somebody really needs a guide, of course, we can always print it out, but truly online has been the way people have gotten it. They get it through our e-news. They can look online at the Arlington va.us and then search 55+ guide. They can pull it up on their phone. But when I go to outreach events, I've been thinking a lot about it, like QR codes where you just scan your phone. I remember going to a restaurant, I'm like, what is this? Now I know how to use them, but thinking of new ways. So if anybody has anything that has worked for them, please let us know, because I know accessibility is a very big piece for us. We want to make sure everybody gets the information, not just those who have phones or can afford a phone. So we're definitely looking at all options.
Okay.
And what Jessica's talked about in terms of the challenge of getting information out to people who don't know about us. It's the same thing Brenda talked about, Michelle, myself, this Michelle Thomas, this is all of our issue, that the people who know about us know that we're a hidden gem and they take advantage of it. And the bulk of people don't know. And that's the challenge that we're all facing. And there are things we can do. And, I don't think we're going in the right direction. I think we're going in the wrong direction in terms of getting information out to people. I think we have to think more about bringing programs to people as opposed to expecting people to come to the centers. And I think there are blue sky ideas that we should be able to put out on the table to increase participation by people around the county.
Good point. And I
Yeah.
think that'll be a part of the discussion as we develop the ambassador program. What does that look like as well?
Right.
So I want to be sensitive to people's time. Steve, I did see what you had written already in the meeting chat, but let's hear more about it, because we talk a lot about, certain programs that are more focused on older adults, but yours is a little bit broader talk about the David M. Brown Planetarium and other things that you're involved with.
Well, first I want to mention that we don't own the planetarium. The Arlington Public Schools owns the planetarium.
Okay.
And because of funding limitations, they are not going to have any more public program. They're not going to have any public programs this school year. But the Friends of the Planetarium are having public programs 1 weekend a month through June. And I put in the chat the link to our website where you can find that schedule. And also, I want to mention, and I did in the chat, that the Arlington Public Schools is having its celebration of the reopening of the planetarium on Saturday, starting at 11. And if you're a member of Friends of the Planetarium, you can stick around for our annual meeting at 1:30 on Saturday. And as I mentioned, this is the 1 weekend a month, and so we will actually be having full dome planetarium programs on Sunday.
Okay. And Steve, are you aware of any other kinds of programs between, say, the Arlington Public School System and older adults that, you know, I'm hearing so often about intergenerational kinds of activities, which is so excellent. Are you aware of anything else that the schools are doing that might involve older adults?
I am not. I'm sorry.
Okay.
The only interaction that I have with the schools is through the planetarium.
Okay. Any other activities that you're involved with that you think would be important?
I can't think of any right off the top of my head. Thank you for asking.
Okay, well, and again, that's why Michelle is here. I know she's taking copious notes, Michelle McMahon, and we want to make sure that, Michelle, you're picking up everything that everybody is saying here. And we already talked a little bit about Laura and Encore Learning, and that is a really popular major program in this area. So I would assume eventually, Michelle, you'll be in touch with her. I also noticed that Jim Morris did indicate, in fact, somebody else alluded to it about oh, Jessica, you talked about the fashion show and silent auction at the at Lubber Run. And so, Jim, if you have anything else to add, please put it in the chat so we can all see it. And so with that, I want to turn it over to Michelle. Yes.
Cheryl, could I quickly just, because I'm working on the guide, and I could quickly mention the Lubber Run Spring Fling is back. It helps us raise funds for Lubber Run's programs with a silent auction and a fashion show featuring clothes provided by Blossom's Boutique and modeled by actual 55 participants. There'll be refreshments and prizes, and donations such as jewelry and other items can be dropped off. So there'll be more information in the guide, but I just thought that was an exciting kind of program that the participants are going to actually model.
Excellent, excellent. No, I think that's great, and I'm glad that Jim mentioned it, and Jessica, you did too. So thank you for that. So Michelle Thomas, we want to also hear from you in terms of Agency on Aging activities and VICAP update. What do you have to tell us?
Yes, absolutely. So in addition to the Medicare counseling that our program provides, we are looking at ways to continue to reach and serve the underserved communities, looking at program expansion, honing in on, and we'll find a bilingual team member, specifically in Spanish, to help with counseling and outreach roles that we have. I'm also really honing in and looking on at ways to target retired employees. We get a lot of calls from federal retirees, as well as individuals who are retiring from Arlington County government and Arlington County public schools. And they have a lot of questions about the marry of their health insurance, their employer health insurance, and of course Medicare, how the two work together if they do at all. And so I'm actually working with one of the volunteers who used to work at HHS, of course, on the federal level, in a high level position. And we are crafting some language and information so that we can start to serve more retirees in the nation's capital. I'm also looking at ways to reach the LGBTQIA plus community, focusing on seniors and senior programming. And then as a result of the Commission on Aging Path Goals, Link and I are working closely together to create a scams model. We're looking at Triad. We're also looking at the ambassador program and other tools and resources so that we can be able to create and expand. Link mentioned some stats that he came across earlier, and I work very closely with the Senior Medicare Patrol. And we do a lot of work around that already, but that's something that we're going to continue to expand. We actually have a program scheduled. Thank you, Jessica, who's here, and also Nick in his absence, who's helped me to schedule a March program whereby we're going to have a representative from the Senior Medicare Patrol, the Federal Trade Commission, and then, of course, my office, and then JP from the Arlington County Police Department. And so that is going to be the kickoff. But again, Link and I are working very closely so that we can formulate some type of work group or program specifically targeted towards seniors in the Arlington community who are being scammed. Helen King has mentioned, I think along with Rachel, many times that the AAA funding is being hit very hard. I just want to pose that to those individuals who are here that may not be aware. The AAAs are losing about $700,000 in funding, and there are 2 out of the 11 programs here in the Northern Virginia area that are being impacted. Arlington County AAA is one of them. So there's a lot of messaging that's been coming out. Helen has provided talking points for anyone who's interested in contacting their local legislator, so that we can get more support, rally more support around this very critical issue. Because when funding is cut from the AAA, which VICAP is part of the AAA, but when funding is cut from the AAA, it's going to start impacting things like home delivered meals, congregate meals, home care, support for caregivers, and many other areas. So if you want the talking points, please do connect directly with Helen. She can give them to you. And if you have any other ideas about things that you would like to see my office push out, please do let me know, and I'm happy to talk with you offline about it. Thank you.
Okay. Wow. That's serious stuff. That's quite a reduction in funding. And so, so is that your report then, Michelle?
Yes.
Okay. The other quick thing then here is the age-friendly Arlington update. I see that neither Cynthia Davis or Erica Wood are here, but for those of you who have an interest in the age-friendly plan, Cynthia did report this morning at the Commission on Aging that, ironically, we're coming to the end of the first 5-year period of the age-friendly Arlington, and that the task force will be meeting at the beginning of February to start looking at what next. What have we accomplished so far, or what's been accomplished in terms of making Arlington more age-friendly. So that will be the agenda for that task force meeting. So it's nice to know that we are still part of an age-friendly community and all the things that you guys are doing. I also want to welcome Carlos. Carlos is on voice rest today. And so while he is not talking, he is listening to what we have to say. And so Carlos, we're glad that you're here. But I promise you, I won't ask you any questions right now because I don't want to in any way injure your voice. You need to definitely, voice rest was always something as a singer that I knew a little bit about something about that. So it's 3:03. Any final comments from anyone? If that's the case, then our next meeting will be in March. This committee meets every other month. And again, I know that some of you had concern. One thing I would just quickly add, Michelle McMahon, for you is that two groups that were not here that are sometimes join us are the Arlington Public Library and also Virginia Hospital Center. So those would definitely be two organizations that ordinarily report what their activities are. And I'd be happy to give you the names of those folks to contact in terms of what's coming up for the coming year.
Okay, that'd be great.
Yeah, both have excellent programs. And to that point, Michelle, if you haven't already, you might want to put your contact information in the chat, or you can send it. I have it too, and I can send it out when we send the recording of this meeting, so that if people think of somebody else that you should be talking to, you can be in touch with them as well.
Okay, yeah, I just popped it in there.
Okay. So unless I hear differently, again, the PIO meeting the next one will be March 27th, which is on a Monday at 2 o'clock. And we'll send you more information as to who will be presenting at that time. But thank you so much. I think this was really helpful. I think it taught us all a lot about what's going on, and kudos on all of your good work helping older adults in Arlington, and have a good year.